Hello, my name is Megan Jones. I am here today to perform a head-to-toe assessment for Maryville University's Advanced Health Assessment class. This is my friend Rebecca. Prior to entering the room, Rebecca emptied her bladder. We obtained her vital signs, her height and weight, and we conducted vision testing with both the Snellen for distance and the Rosenbaum for nearsighted, and everything was good. So first I'm just going to inspect your head. I'm going to be looking for any abnormalities, any asymmetries, any sort of abnormal moles or discolorations. Everything is good. I'm going to look at the symmetry of your ears. You're good. No drooping of the eyes. And I'm going to check out your hair distribution. Hair is good. No texture issues, and hair distribution is appropriate. Alright, so now we're going to go into some of the cranial nerves. So first I'm going to check your facial nerve. So just go ahead and squeeze your eyes shut and open them. Give me a smile. Puff out your cheeks and wrinkle your forehead for me. Good. All that response was appropriate. So now I'm going to look at your hypoglossal nerve. So go ahead and stick out your tongue and move it side to side and up and down. Perfect. And all that is appropriate. Now I'm going to look at your trigeminal nerve, so go ahead and clench your jaw, and I'm just going to feel here for muscle tone. It's appropriate. And I'm going to check the sensation on your face, so I'm just going to rub this across your forehead, on your cheeks, and on your chin, and you just tell me if there's any sort of abnormal sensation or if you don't feel it.
Feels good.
Okay. Alright, so now I'm once again going to palpate the temporomandibular joint. Go ahead and just open up and close your mouth. And I'm feeling for any sort of clicking, any pops, which there aren't. And now I'm going to examine your sinuses. So we'll start with your maxillary sinuses here, feeling for any sort of swelling or discomfort. Nothing there. And the facial frontal sinuses, that's good. Okay. So we're going to move on to your eyes. So first just visualizing the eyes, noting that there is no drooping, no sort of abnormal gaze. Everything looks appropriate. The distribution of the hair in your eyebrows is appropriate and your eyelashes are facing forward. I'm noting that your sclera are white, and when I just bring down your eyelid here, noting that your conjunctiva is pink and moist. Okay, so then I'm going to just palpate your lacrimal apparatus here. No swelling or tenderness in that area. Good. Okay. So now I'm just going to examine your pupillary reaction. So first, I'm just going to shine it in your eye and check for response. And then I'm going to check for consensual response in the other eye. And I will do the same on the other side. Okay, and the response is appropriate. So now I'm just going to check for extraocular movement. So I'm just going to have you cover one eye, looking right at my nose. Good. Now bring that arm down and cover the other eye. Good. And everything was normal. Next we're going to check your cardinal visions, or cardinal gaze. 6 cardinal points of gaze. There we go. So just follow my finger. Just with your eyes. Don't move your head or your neck at all. Good. And all of that is appropriate. Alright, now we're going to move to your ears. So first, again, I'm just checking for symmetry, and everything is good. I'm going to palpate your auricles for any sort of nodules, which I'm not noting. No discharge in the ears. Good. Now I'm going to check your hearing by doing a whisper test. So what I'll do is walk behind you. I'll have you create a little static in one of your ears, and I'll whisper a word, and then we'll move to the next, okay?
Sounds good. Purple. Car.
Good. Alright, now I'm going to do the Weber test, which I'm just going to use my tuning fork here, and what we're going to do is you're just going to tell me if you're hearing the sound in both ears or one ear and which ear that would be, okay?
Both ears.
Okay. Now we're going to do the Rhine test, which is just testing air versus bone conduction. So first I'll just strike the fork and put it on your bone. And then when you stop hearing it, you tell me, and I'll move it to the front of your ear, and then you tell me again when you stop hearing that noise, okay?
Okay. There.
that's appropriate. So now we're going to move on to your nose. So first, again, I'm just going to visualize ensuring that the septum isn't deviated at all from the front. And I'll just examine inside of both nares, noting even distribution and appropriate distribution of hair. No turbinates, mucosa is pink. Now I'll test the patency of each nair, so go ahead and breathe. Good. And on this side? Good. Okay. Alright, so now we're going to move on to your mouth. So first, visualizing your lips, noting no sores, no open lesions, nothing abnormal there, symmetry of your lips. Go ahead and open your mouth. Okay, I'm just examining the mucosa here. It is moist and pink. I'm examining the tongue, which is appropriate. Noting any dental caries, any missing teeth, anything of that sort. Go ahead and lift up your tongue so I can see the bottom of your mouth. Good. No lesions or anything. Okay, now go ahead and I'm just going to shine my light back and you're going to say ah.
Ah.
Good. Everything looks good back there. Uvula is midline, no deviation. Now I'm going to move on to your neck. So again, visualizing the neck. I'm not noting any masses, any abnormalities. Palpating to ensure that the trachea is midline, which it is. I'm going to check your carotid pulse. Not bounding. And symmetrical bilaterally. So now I'm going to check your thyroid. So I'll just put my hand on your neck here and go ahead and swallow. Good. And feeling on the other side. Swallow. Good. Alright, next I'm going to go ahead and just auscultate your carotid arteries, noting any bruits with the bell. Okay, nothing on this side. And then I'll auscultate your thyroid as well. Okay. Good. Now I just want you to perform some range of motion, so go ahead and turn your head from side to side. And your ear to your neck. Or, you know what I mean, ear to your shoulder. And then just give me a nod. Perfect. And then shrug your shoulders. Wonderful. Okay. Alright, so now I'm going to check your lymph nodes. So I'm going to check your pre-auricular, post-auricular, occipital. I'll check your posterior cervical chain and anterior cervical chain. Move up to your submandibular and submental. And then I'm going to go ahead and just check your clavicular. Good. No abnormal swelling noted. No tenderness. Good. Okay, so now we're going to move on to your upper extremities. So visualizing to ensure there's no abnormal moles. Hair distribution is appropriate. And then checking your hands. Good. Pink. And then I'm going to note your capillary refill, which is less than 3 seconds. No clubbing of the fingernails and no cyanosis. And now I'll check your pulses. So first we'll check your brachial. And then your radial pulses. Wonderful. Okay, so now I'm going to move on to your back. So first I'm just going to note her respirations, noting the configuration, examining for any abnormal moles, anything out of the ordinary, which everything looks appropriate. I'm going to just go ahead and palpate your costovertebral angle, noting any swelling, any discomfort, and then I'll percuss in this area. Any tenderness of the kidneys? Nothing there. Okay, so now I'm going to observe your respiratory pattern. Her respirations are equal on both sides. Just to make sure, I'm going to just feel for that. Go ahead and take a deep breath. Good. Expansion is bilateral on both sides. And next I'm going to check for tactile phragmitis. So I'm going to put my hands on your back, and when you feel my hands there, you just say 99, okay?
99. 99.
Good. Any
99.
Good. Any increase in phragmitis could indicate a mass or fluid buildup, and everything there seems appropriate. So now I'm going to go ahead and percuss your posterior chest. So here I'm just going to kind of go in the intercostal space. Noting any hyperresonance. Good, and I'll percuss the lateral walls as well. Now I'm going to measure your diaphragmatic excursion, so go ahead and take a deep breath and hold it. Okay, go ahead and breathe out. Hold that. Okay. I'm just noting that the resonance was, the distance was between 3 and 6 centimeters from the change in the sound, which it was. So that is good. Now I'm going to go ahead and auscultate your lungs. So when you feel the stethoscope on your back, I just want you to take a big deep breath in and out, okay?
Mm-hmm.
Good. Breath sounds are clear and equal bilaterally. Now I'm going to move to the anterior chest. So first I'm just going to inspect skin symmetry. As you're breathing in and out, I'm just making sure that your lung expansion is symmetrical on both sides. So everything is good there. I'm just going to listen to your anterior chest, okay? Again, we're just going to do some breathing. Good. Now I'll be listening to your cardiac sounds. So first I'm going to start over here on your aortic, pulmonic, go to Erb's point, tricuspid, and mitral. Good. So now I'm going to just palpate your precordium. So what I'll have you do is lay back. Go ahead and put this out for you. So here I'm just assessing for any thrills, any other sorts of issues. So first I'm going to start here at the apex. Move to the mid-sternal. And up to the base. Good. So now I'm going to assess your abdomen. I'm going to just hold this up. So first I'm just visualizing, noting that there's no abnormalities, no evidence of previous surgeries, no evident bumps, no abnormal moles, etc. Everything looks good. So now I'm also noting that her umbilicus is centrally located. And now we're going to auscultate first vowel sounds. And I'll listen for up to 2 minutes in each quadrant, noting sound. Good. Vowel sounds are present in all 4 quadrants. Now I'm going to go ahead and auscultate the arteries. So with the bell of the stethoscope, first I'll note the aortic artery. And check the renal, both left and right. And then I'll note the iliac and femoral. Good. Okay, now I'm going to go ahead and percuss the liver border. Noting for dullness. Good. And now I'll move to the other side and assess the splenic border. Good. Alright, so now I'm going to move on to palpation. So first I'll start with light palpation just to ensure that there's no tenderness anywhere in the abdomen. Everything feel okay?
Yep.
Okay. Now I move on to liver palpation. Okay, I'll examine the splenic palpation. And now I'll move on to the renal moving up on pushing up on the costovertebral angle. The same on the other side here. Good. Now I want to examine the lymph nodes in your, can't think of the word I'm looking for, up here in your armpit. We'll just go with that. Okay, no abnormalities there. Alright, everything is appropriate, good. Alright, so now I'm going to move on to her lower extremities. Oh, I'm sorry. Okay, you got it. So first I'm going to just examine hair distribution, noting a scar here on her right leg. No edema, no tenderness in the legs at all, and I'll be assessing her pedal pulses. Okay, moving up to the posterior tibial, and then the popliteal bilaterally. Okay, everything is 2+ and normal. So next I'll have you go ahead and sit up. Okay, so now we're just going to examine your musculoskeletal system. So first I'll be checking your reflexes. Go ahead and just kind of rest your arm in my hand here. Looking for a hand jump, good. Assess up here, looking for, okay, good. Over here. Good. And up here. Good. Alright, now we'll assess patellar reflex here. Good. Alright, patellar reflex there. Good. Alright, and finally we're going to check your Achilles reflex. Good. Kind of rest your leg in my hand here. Good. Alright, so last but not least, we're going to do some assessment of your strength in your arms. So one more time, I'm just going to have you push up against my hands here. Good. Okay, so now you can push against my hands and pull me towards you. Good. Now push up and push down. Good resistance there. And I'll have you do the same thing with your feet. So go ahead and uncross, push up. Good, and push down like you're pushing on a gas pedal. Good. All right. I'm going to have you bring your arms back, up above you. Bring your arms back like this. Okay, good. Now I'll have you stand up. I'm just going to lastly assess your lumbar spine. So go ahead and just bend forward as much as is appropriate for you. Okay, noting spine is straight here. No pain with bending. Go ahead and stand up. Okay, go ahead and lean back. Good. All right. Everything looks great. So Rebecca, this concludes your head-to-toe assessment. Thank you very much for your time.
Thanks.